Nissan's national year-end sales event. Get year-end deals at your Nissan dealer now.
Well, imagine finding out that your child has a disorder so rare that most doctors have only read about it in books. A Southern California couple in just that situation discovered, though, that one of the only doctors in this country who could help save their son's life was just hours away at Lucille Packard Children's Hospital at Stanford.
Thank you. I love you, too.
2-year-old Noah is a lover boy.
Step up. Almost. All right. Look at you, dude. Where are you going?
And without question, the greatest source of joy for David and Maria Saenz. 2 months ago, the West Covina couple got a frightening diagnosis after their active toddler suddenly appeared to be paralyzed on his left side.
His whole left side of the body shut down. His face to his arm to his leg.
At first, doctors thought Noah, who was born with Down syndrome, had a brain tumor. But after a battery of tests, doctors discovered he'd suffered a stroke caused by moyamoya.
We were like, okay, what is this? We've never heard about this before. And then it scared us even more because none of his pediatricians had heard about it. They're like, we read about it in textbooks, but we never had a patient with this.
So the Saenz found their own answers on the internet at moyamoya.com, a website that led them to Stanford and to the only treatment that seems to prevent life-threatening strokes brought on by the disorder. Moyamoya is a disease so uncommon that most family doctors have never even heard of it. The name is Japanese for puff of smoke, which is the way it appears on an angiogram.
Here are the moyamoya vessels. You see those?
Dr. Gary Steinberg, head of neurosurgery at Stanford University Medical Center, is an expert in moyamoya and has treated more than 213 patients, both at Stanford and Packard Children's Hospital. The disease typically afflicts children under 10 or adults 30 to 40. The disorder narrows and blocks blood vessels at the base of the brain.
So there's not enough blood flow getting to the brain, but as a result of that, normal tiny vessels in the brain proliferate and enlarge, and those are the moyamoya vessels. And those vessels, because they're so fragile, can rupture and cause a hemorrhage.
To avoid that bleeding, Dr. Steinberg, seen here in this video provided by Packard Children's Hospital, performs a brain bypass.
When you provide a new blood flow to the brain in the moyamoya patients, we see increased blood flow to that particular part of the brain that we have revascularized. And the patients stop having TIAs and strokes.
In adults, Dr. Steinberg creates that new blood source by cutting the scalp artery and connecting it to an artery inside the skull on the surface of the brain. In children like Noah, where the vessels are smaller than a strand of hair, Dr. Steinberg performs an indirect bypass, again, using the scalp artery. Only here, it's left intact and simply dropped on the brain.
And although it's not sewn directly to the vessels on the brain, over the course of several months, it grows new vessels into the brain.
They're delicate procedures that require magnifying vessels 100 times. But in both cases, the blocked arteries are never touched.
What are you doing, dude?
Noah had the procedure performed on both sides of his brain just a week apart.
Just after, 2 days of having surgery, he's walking around, playing, back to almost his normal self.
A huge relief to Noah's mom and dad, who can now count on lots more kisses.
Brain surgery, it's not something you figure somebody's gonna just jump right out of bed and say, hey, let's go. But yeah, he just was amazing.
He's sweet. Now, doctors aren't sure exactly what causes moyamoya, but they do think there's some sort of a genetic component to it, and it appears to afflict Asians more. As for Noah, he's making great progress, and he won't likely need any more surgery. If you want to find out more about moyamoya or how you can get in touch with Dr. Steinberg, all you have to do is go to abc7news.com and look for Assignment 7.
Very interesting. Well, just ahead tonight, a stunning